listeners, I'm pleased to welcome you back to Connecting Citizens to Science. I'm your host, Dr. Kim Ozano, and this is a podcast where we explore global health and development. So today is the second part of our gender justice finale and the last episode in the mini-series Backlash, Resistance and the Path to Gender Justice. Over the last 6 episodes, we've covered so much ground. We've talked about gender and how it is played out in different contexts and for different people. We've looked at concepts, theories, and examined gender as a system. If you haven't already listened to those episodes, do revisit them. They are educational, thought-provoking, and really help you to extend your thinking about gender inequalities and gender injustice. In this last episode, we're starting to move from understanding and conceptual thinking to action.
It becomes really important to talk to people and understand how are they understanding gender.
So today we're going to be talking to our guests about the practical side of gender-responsive work, the tools, the frameworks, the approaches that can help us to respond ethically, thoughtfully, and effectively to the realities that we heard about in part 1. And to help us do that again, we're joined by Dr. Rosemary Morgan, who is an associate professor at the Department of International Health at Johns Hopkins Bloomberg School of Public Health. We're also joined by Salima Sara Kabir, who is a researcher and educator at the BRAC James P. Grant School of Public Health in Bangladesh. And as always, I have the pleasure of being joined by Ishrat Jahan, who's been an insightful co-host throughout this series. Ishrat is a research fellow at the Center for Gender and Sexual and Reproductive Health at BRAC James P. Grant School of Public Health in Dhaka, Bangladesh. Enjoy the episode. We ended the last episode with Rosemary raising some really important points. She talked about the difference between being gender sensitive, where we acknowledge gender but we don't necessarily act on it, and moving towards a more intentional approach. So something that we would think about in terms of being more gender responsive or gender specific work. And that is where we actively think about how gender inequities might shape people's experiences and outcomes, and how we adapt our work to address some of them. And then there's that one step further, gender-transformative work. And that asks how we actively challenge and change harmful gender norms, gender roles, or power relations, rather than just working around them. So what really came through strongly in the last episode is that this doesn't happen by accident. It requires us to use established frameworks and tools and to be deliberate about how we apply them in practice. So with this in mind, over to you, Ishrat.
Thank you. Those are really important points that I think often does not get discussed enough, especially when we need to be having more conversations about mainstreaming gender. Salima, what are your thoughts on that as someone who researches directly with local communities and you come across how gender is maybe in one way or the other embedded in their everyday?
I'm a big advocate for qualitative data, for rich ethnographic data. And a lot of the work that we do is around that. And I think there needs to be a greater synergy in the work that we do in terms of the big data, the sort of like data sets. Those are really important because they give us a really holistic kind of view of where we're at in the world right now. But then when we're thinking about gender and the way we've been talking about gender, which is it's so deeply contextual, it's so deeply tied to lived experiences, it then becomes really important to ensure that we're also bringing out actual voices, and not only amplifying, but actually bringing out the voices of the communities, the people that we're working with. And I think one of the ways in which we found it to be really empowering is making sure that the work that we do directly involves communities, allows them to be involved in the ways in which we're asking the questions, understanding what kind of language they're using in terms of framing. Because a lot of the times when we're framing questions for research, we come at it from such an academic and almost like jargon-heavy lens. And then when we go to the communities and we validate these tools, we find out that the ways in which we're framing these big ideas around gender sensitization actually comes down to very basic, very day-to-day, daily things. And it becomes really important to talk to people and understand how are they understanding gender. And that is something that I'm such a big advocate for. Right now, we're working on a project around community health workers in Bangladesh. And we've been working around their mental well-being. And when we go into the field and we start talking to them about their lived experiences, their mental well-being, it becomes very apparent that you cannot extricate the gender from this because they're having to juggle their families, their homes, as well as their responsibilities as community health workers. And then in the work that they're doing, they're faced with different forms of harassment on the streets that their male counterparts are not privy to. And so in every step of the work that they do, it becomes apparent that it's only when you start talking to people that you realize that it is embedded, and that conversation doesn't feel so complex anymore because you're doing that. It's coming out through the conversation. But I think it's important to have that reflective lens. Make sure that you're learning as much from the communities as you are trying to get information out from them. If we start thinking about it in terms of like, how does it impact me daily and how does it impact you daily? It can become a little bit simpler and a little bit easier to embed that gender lens into your everyday thinking and everyday work.
We do need to think about other active approaches for increasing gender responsiveness. And Salim has really touched upon one of the important ones, which is meaningful participation and representation, particularly of the communities in which we work with. Communities can be anything from the health workers in the local facility to community health workers to people who live and work in the area. Other active approaches, and we've mentioned this already, is making sure you're bringing in that intersectional lens. I always say if you're not bringing an intersectional lens into your work, you're doing the gender analysis unethically, because of what we're doing is actually privileging those with already very privileged identities, where we're bringing their lived experiences to the forefront. So we must think about how gender intersects with other social identities. And the last one is just making sure we're really taking a context-specific approach. Because as Salim had mentioned, how one community thinks about gender is going to be different from another. So we can't take work from one context and just implement it in another. We have to do the meaningful, on the ground, sometimes bottom-up approach to this work to make sure we're really bringing in that context-specific approach.
And I think, Rosemary, one of the things is it goes so much beyond those numbers to needs, rights, and preferences. And the only way you can find that out is to talk to people. And Salima's given us a great example that this comes through conversations, everyday conversations. Salima, I was wondering, when you have these conversations, it seems almost when you talk that gender comes out naturally. As a researcher, do you have to go in there with a gender agenda and kind of create that consciousness of the gender surroundings? Or is it as organic as you make it sound? Or does it always change?
That's a really interesting question. I hadn't really thought of it that way. I think as a researcher, you need to bring some gender consciousness with you. You need to be aware of these intersecting identities, the ways in which they intersect, and how gender may play a role. But I think if you've got that in the back of your mind, that, okay, everyday things like who's doing the cooking, who's doing the shopping, who's doing the child rearing, these are all gender frameworks in a sense, right? And as long as you've got that in the back of your mind when you're talking to the communities, it comes out quite naturally. Like, women are very much aware of the ways in which they're negotiating, navigating through patriarchy. Every woman you meet, whether it's like very privileged woman in a Western country or a rural community health worker, they're aware of the ways in which they're having to navigate the spaces that, they're living in. And if you go in with a gender lens, you're able to pick out what they're saying in the ways that they're saying it.
I think the other thing about participatory methods and reflexivity links to the concept of power and how power fits within this whole framework and is quite central.
Power is absolutely central and cross-cutting. When we're thinking about these frameworks, you really need to think about how these different gender domains or the ways in which gender power relations manifest as inequities interrelate, right? Because they all affect each other. And some, I like to say, some are a bit more upstream versus downstream. Things like norms, what's appropriate for men and women, boys and girls, or gender minority individuals. Also, decision-making power, autonomy, just the power is embedded in our systems and structures. That's going to impact individuals' own personal autonomy. It's going to impact our access to resources. It's going to impact roles and practices. So we really do need to think about how power is embedded. We need to think about how power shapes discrimination, disadvantage, privilege, and advantage. And that's why that intersectional lens comes in, thinking about different systems and structures of oppression like sexism, racism, heterosexism, ableism, all the isms. right? And how are they shaping our own individual lived experience? And I think what a lot of people don't do in gender work is they don't go that step further. They often they do the sex desegregated data, or they think about how men and women are affected differently, but they don't then link it to different systems and structures of oppression, or even the gender system itself as a system and structure that privileges one group over another. It's often a political action to make that linkage. And that's where that backlash sometimes come in, is when you're making that link. And a lot of us, we need to push ourselves to make sure that we're going that extra step.
Questioning these systems feels like something that's a lot more complicated than it should be, because these systems exist and they're meant to serve people in communities, but ultimately what they end up doing is people in communities end up serving the systems. And so power becomes a very important and critical structure, especially when you talk to very marginalized, very vulnerable groups, because you can really see the ways in which different intersecting power systems, some of which even I benefit from, are impacting the ways in which they're living their lives. So I think power is a really critical kind of area to consider when we're talking about gender, and that's something that you absolutely cannot leave out.
I think one thing that I draw from what both Rosemary, you, and Salima said is the idea of researching upwards, because there's a lot of our research, gender and beyond. When we think about community, if you look at society as a hierarchical thing, we look where the communities are in the bottom, and that's where we focus on. So power structures that, Salima, you say are sitting heavily on us. I like to think that they're invisible, and oftentimes we aren't thinking about them because they're basically the water we're living in.
Yeah, just to reflect on something you said, Ishrat, is how thinking about power, and that often people don't see it because it's part of our lived experiences. So I think that using these gender tools and lenses, intersectionality, really helps to not only shine a light on disadvantage and discrimination, but also power and privilege, and how that's also impacting people's lived experiences or health outcomes. And then going to the practical tools, our practical approaches. I think this is really important in gender work. First, really to think about who our audiences are and making sure that we have the most appropriate messaging for the audience. And this also links to potential backlash, because you don't want to turn people away. You don't want to automatically close doors. And sometimes that means not using the word gender at all in our messaging, right? Sometimes that means saying women and girls, even though we know gender is much broader than that. Sometimes that means that we need to make the business case for gender. So a lot of people who work in this space use rights-based arguments, and I am so very much in support of those. I absolutely believe that we need to do this because it's the right thing to do, but people don't buy those. A lot of people do not buy those arguments. So making the business case really means demonstrating why addressing gender inequalities and inequities is not only a moral or human rights imperative, and sometimes we don't even use that language, but also strategic and practical for organizations, governments, or programs. For example, showing how gender equality improves outcomes, how when we address the health of women and girls, how it can improve efficiency and effectiveness of our interventions, right? Because often if we're not thinking about how gender power relations manifest as inequities, they can impede our programming and we're not able to meet our objectives. How it can be a form of risk management, particularly because when we don't bring in a gender lens, it could lead to harmful consequences for the individuals in which we're working with. So what we want to do is we want to do like a harm reduction, right? We want to make sure that our organizations aren't perpetuating harm. And then also, of course, how does it lead to evidence-based benefits in our work? Not only, again, gender mainstreaming, turning the lens inwards, making sure we have equitable teams or like men and women on our teams, thinking about women in leadership positions. How does that lead to more diverse decision-making, more evidence-based decision-making? And then often these are the arguments that we have to make, even if they go against our very like moral fiber of what we think is right. But if we want to get it done, I think we do need to think about how do we make the business case? How do we use the appropriate language when we're communicating to individuals? And then another practical approach is building collaborations and networks with organizations on the ground, with advocacy groups, right? With organizations that have different forms of power. Because I think we are stronger when we work together, both as individuals and organizations. And that's such an important thing to do when we're addressing something as ubiquitous as gender inequality.
I think I was thinking about it within the Bangladeshi context, and I was thinking the business case in the Bangladeshi context is often taking on or adopting religious language and using that framing sometimes as well. In a lot of work we do, it's becoming more and more common is engaging religious leaders and like local leaders into the conversations as well, because it's very much that same thing of making that business case just from the person that you're pitching to is different and you're just catering to your audience. But like within communities, these local leaders and these religious leaders hold so much power. We talk about how important it is to engage the husband when we're talking to women in rural communities, especially. So oftentimes, when we take a gender approach, we're thinking we have to target these women and we have to give them all of these information, and we have to do it in this really sterilized way so that they get all of the information they need and they can live their lives better. But we don't recognize that, again, they're also living in this sort of very embedded system with different people around them, different people that they have to live with and navigate. And we can go away after we've given our message, but they have to live with the consequences of it. And so it becomes very important to engage everybody else around the people that we're working with. And I don't want to reduce gender to women, but like women or any other groups that are working with the people around them and understanding their viewpoints as well and trying to come at it with a very balanced approach, I think is very important.
I love this. A real great point. And the people that you work with are living in the social system of gender, and understanding and thinking about everybody in that social system is the only way and a practical way. So Ishrat, those final points are so large. I'll leave it to you to wrap up.
That's a big task. Thanks for that. But yeah, I think those are really great points. And thank you so much, Rosemary and Salima, for amazing insights on how we think of gender with all its complexities. I think a point that I would like to add, and it's taking away from both what Rosemary and Salima said, is that oftentimes as researchers, or at least I have found myself doing this, that even as a researcher, I tend to just look at gender and not connect it to other issues. So we had started out this discussion talking about crisis conditions and living in a world where increasingly it's becoming more unpredictable and more complicated. And one takeaway that I have had over the length of this podcast, at least, is that it's very important to collaborate and develop connections across movements and across a research agenda. So you cannot, for example, be doing climate research without having gender as a very deep embedded component of it. So I think that's a note that I would like to end on.
Thank you, Ishrat. As ever, a wonderful take home. It's about thinking about gender and connecting across movements and agendas, and thinking about mainstreaming gender in everything we do, using those frameworks in a practical, sensible way that can move gender forward and resist the backlash that we're experiencing every day and are seeing in the news in our everyday lives. So it's been a privilege to be able to host this 6-part mini-series on gender justice, and I've learned a lot. And to our listeners, check out the other 5 episodes. Each time, I can promise you, when you leave, you will be doing a lot of thinking about your lives and your work. Thank you to our wonderful guests today for making me think harder again. And Ishrat, what a great co-host you've been. That brings us to the end of this gender justice mini-series, Backlash, Resistance, and the Path to Gender Justice. Our guests have shown just how interconnected gender, power, context, and crisis really are, and how important it is that we don't treat gender as an add-on, but as something that is central to the way we design, deliver, and evaluate our work. A huge thank you to Rosemary Morgan and Salima Sarah Kabir for their depth, clarity, and generosity throughout this conversation. And to you listeners, thank you for joining us for this 2-part finale. If you're only just joining the conversation, do go back and listen to the other 6 episodes from this mini-series. We cover everything from allyship and solidarity to navigating backlash to lived experiences of gender inequities and inequalities to co-creating change with communities across the globe. I hope it leaves you thinking differently, acting differently, and expanding your own work and horizons. Until next time, stay connected.